Thank you for the opportunity to share time with you today. We're here because of the work of so many of you who have done so much. I like to ask 4 key questions. How did we get here? Where are we now? Where do we want to go? And perhaps most important, how do we get there? So a little history is important. EMS really started with a view of the need to move people rapidly to emergency care, and that was using the model found on the battlefield in Korea. EMS in America was created to respond to a growing issue of car crashes, and that is why EMS lives so strongly at NHTSA. Since EMS was built by the states in response to federal funds, what we began is our growth from the ground up and not nationally. So we kept improving and growing wonderfully. What we did not do is come together with one voice. So as a result, in many ways, EMS was fragmented, insulated, and sometimes even isolated. I was an EMS doc from the field, and I too shared my local view. But when I came to NHTSA, Congress wanted to cut EMS from the NHTSA budget. So it was clear that we had much to do to unite EMS. What we needed was a compelling national vision that brought people together and acted as a prism for united decision-making and action. So we did just that. We brought together leaders in the field and asked them to look beyond the limits of the day and look to where healthcare is going and where EMS needed to be, a true vision of the future. My only request as administrator was that the vision be not Flintstonian, but Jetsonian. The original EMS leadership group expanded that tent. They initiated the journey, and they did just that. They crafted a strategic vision that created the impetus for new standards, new training, new tools, resources, and data systems, new leadership approaches, and much, much more. Most strategic visions gather dust on a shelf, but you breathe life into it. And that was the beginning of a change that continues to this day. You have transformed EMS. Think about that. The group looked past what was in front of them to see the future. Remember, this was in 1996. There was no wireless internet. There was no Google. There were no smartphones, no ubiquitous GPS. But the group did know that EMS could deliver quality care by having certain standards and organizational structures, data systems, tools, and leaderships, and they committed to doing that. And as a result of 20 years of work, not only have you transformed EMS, that work continues today, armed with the guiding light. As changes continued in our society, social, clinical, technological, and financial, EMS, because of its vision, was able to take advantage of those changes and incorporate them and build upon them to leap even further. So opportunity knocks again. We've now come to a time where change is accelerating even more rapidly. The spread of information, the spread of change is faster than ever. What that means is that the ability to look beyond is even more complex than ever before. People have a tendency to speak in incremental change. That simply won't work anymore. As a result of that kind of change is little or no change. So the important question is whether we can come together again, look at where we were, look at where we are now, and look at where we need to go by lifting our eyes even higher and envisioning, not incrementally, but exponentially. Look around you at the current healthcare changes. The infrastructure is changing. The patients are changing. Their needs are changing. And partly due to your success, people are living longer. We have an aging population, patients living with diseases that would have killed them in the past, a lot of chronic diseases. We have a country becoming more diverse. The movement of care from hospitals to outpatient settings and to population health. We see the growth of freestanding and hospital satellite emergency departments, micro-hospitals, imaging centers in the community, telehealth, and new healthcare resources like community health workers and community paramedics. We now have an age of growth of technology like robotics, telehealth of mobile devices, portable medical devices, machine learning, wearables, and even implantables. So EMS was originally created to make it easier to move patients towards centralized care. But healthcare is actually moving to decentralized care and getting closer to the patient. And one group has been going to the patient, wherever they may be, for decades, and that group is you, the group sitting here today. So healthcare, not just EMS, is asking itself, how do we meet the needs of the patients that we serve? The redesign of healthcare in the future is about integration and connectivity. It's a big challenge, but it's also a big opportunity. So please don't get stuck on finance. I see that a lot. I often get asked, who's going to pay for all this? But that's not unique to EMS, but to all of healthcare. Don't let it be a barrier. The truth is that finance will change too. In order to change payments, one simply has to know, what are we paying for? Where's the value? In the past, you were prophets of the future who clearly saw where EMS needed to go. Just look at that opening scenario from 1996. You saw it, and you breathed life into that vision, and you made it a reality. Now you have the opportunity to lead it again, to take the profession and the country to higher ground. It's worth repeating. Don't go incremental, go exponential. Those who know me know that I like one particular quote by Peter Drucker that bears repeating, and I'll end on that. Mr. Drucker made it simple. The best way to predict the future, the absolute best way to predict the future, is to create it. As I look at this group, I can say with absolute certainty that you will take us to even higher ground. As a former administrator, as an emergency physician, as a husband and father, and a member of the public, let me simply say thank you for being here and for what you do each and every day. Godspeed and good luck, and thank you again.